I honestly laughed a little bit because I was like, this is so ironic. Of course I would get a brain tumor with where I work.
From caring for patients with neurological issues to becoming a patient herself, CBS 4's Chelsea Helms introduces us to a nurse who's now back at work with a deeper understanding of what her patients are experiencing.
Here in the Neuro ICU at IU Health Methodist, Liza Smith is used to providing care. Until recently, she found herself on the receiving end.
A nurse's worst nightmare is to be admitted to the hospital, let alone your own unit.
Months of debilitating headaches eventually landed her in a hospital bed under the care of her own colleagues.
You definitely have to put your emotions aside in the moment and just do what you know needs to be done.
She had a very large tumor and cyst, putting significant pressure on her brain.
The irony of her diagnosis, not lost on Lisa.
Of course I would get a brain tumor with where I work.
In hindsight, the signs were there. She'd been experiencing many of the same symptoms as the patients she typically sees.
I was taking medicine every 4 hours. I was taking probably too much medicine just because I wanted some sort of relief, which it didn't really help. But it was like, this is all I can do. I was laying on the couch. Had a blanket over my head. I was just a shell of a person.
They push on the brainstem, which conducts all the signals from the brain to the spinal cord and the rest of the body. And too much pressure there can lead to worsening symptoms and even death if untreated.
With her condition worsening every day, in February, Lisa had a craniotomy.
I think the stakes feel higher. They always feel high in brain surgery, but when it's someone you know who's friends and family of our group and who we work with every day, it's someone you definitely get a little more anxious about, and you really want to make sure they have a really good outcome.
Both the cyst and tumor were removed. As for how long they'd been there,
they don't have rings like trees, so we can never tell for sure.
What is known, though, is from the moment she was admitted until the day she was released, she had her team by her side.
Seeing your own coworkers come in and care for you and give you your meds, and it just brings a whole different viewpoint on everything.
The whole team just really rallied around her, and I don't think there's anywhere else we would have wanted her to be.
3 months later, she's back in the Neuro ICU, once again as a nurse.
Was thankful that everyone was right there when they needed to be, and when I desperately needed it. And had I not been in the hospital or not been on the ICU, I don't know if I would still be here today.
Back to caring for patients, but with a deeper understanding of what it means to be one.
It's part of me now.
Our thanks to Chelsea for that story.